My name is Chris Argueta, and I'll be talking about my Health Career Connection internship that I had for the summer of 2017 at the Center for Latino Community Health. So, first off, a little bit about me, my background. Born in Los Angeles, California, where I currently live in Norwalk. I'm half Salvadoran, half Honduran. I've done a good amount of traveling both in and out of the country, and I'm also bilingual in Spanish and English. As for my education, for my undergrad, I went to UC Berkeley, where I got my bachelor's degree in public health. I also was a student athlete all 4 years as a member of the Cal men's soccer team. And my senior year, I also earned an internship position at the Health Service Internship Program, where I was placed at Operation Access in San Francisco, which was great. As for Health Career Connection, I was placed at Center for Latino Community Health, which was established in 2005 in the city of Long Beach, California. Their mission is to improve, promote, and advocate for the health, culture, and well-being of diverse Latino, Hispanic communities, which was perfect for me because it aligned right with my goals in terms of impacting the Latino community and focusing on all the different aspects of public health. My supervisor was Director Dr. Mara Bird, who was amazing and provided me with tons of opportunities and tasks to make me more well-versed. And while I was there, my main internship project was the Salud de la Vida Cheers to Life project, which had been going on for about 2 years, and so I kind of got to jump on to the end of it. And ultimately, it's about HIV prevention, Hep C prevention, also substance abuse and drinking. And the whole point of it wasn't necessarily to, like a DARE program, to get people to stop drinking or stop using substances or not have sex. It was more so to get people informed as much as possible. And if they are going to do these things, that they have to be well informed and use as much precaution as possible, things such as condoms, for example. And one of the reasons why this project even began was because 47% of new HIV infections in the LA County are specifically among Latinos. Right? So these are all things that definitely contributed to how essential this project really was for the LA or the community as a whole in Long Beach and the LA County. And so our evidence-based intervention that we use was a 2-day workshop where we talked about all 4 topics and really tried to hammer home the message to our target group of 18 to 24-year-old Latino young adults. Now, for my personal responsibilities as an assistant program coordinator there, I assisted in recruitment, outreach, and also coordinated and taught those HIV and HCV, alcohol and substance abuse workshops. So that was also a really, really great experience where I got to really kind of get that hands-on teaching experience, and also constantly reviewing scientific literature to stay up to date with all our information, participating in continuing education activities, attending conferences, seminars to keep up my knowledge, and also performing data entry, other clerical work, Excel stuff, EndNote, or SPSS, whatever was needed for the project to be completed. So some additional responsibilities I had aside from my main project were things like working on grant proposals, so biographical sketches, narratives, abstracts, reviewing all things like that, even coming up with an abstract on my own, as well as learning about budgeting and working on budgeting. I got the chance to work on about 3 or 4 different budgeting experiences for new grants, and also infographic training sessions where I got to learn more about marketing and how to better advertise whatever your project is, which was definitely useful for future references, as well as attending webinars and other seminars, and also getting the opportunity to guest speak to other programs, universities, and communities as well, which was amazing. Now, for my future personally, I ended up getting the position at Charles Harger University as a research coordinator, where I will continue to work on HIV. However, instead of prevention, I'll be focusing on HIV treatment now, where I'll be working with HIV positive men who are Latino or African American within the LA County, which is great because I also get to continue focusing on the Latino population as well as the African American population and my home of Los Angeles, California. It also combines mental health and public health, which is great because I'm definitely getting a much newer perspective of public health when you bring in mental health. And also, MPH, MBA, PhD are all potential possibilities for me for the future. I'm still uncertain, but I know that with more experience, more time, I'll definitely kind of narrow down my mind and be able to choose which one I want. Now, for you future HCC interns, as Jeff Oxendine always says, you are right where you're supposed to be. So make as many mentors as possible, make as many friends, stay in contact with as many people as you can from your HCC cohort. And everybody who is a part of Health Career Connection is amazing, and the achievements they've done and the stories they have, you'll come to find are all beautiful. So try and find as many ways as possible to make the most of your internship and gain as many tools as you can to make you that complete public health professional. So thank you for listening to my Health Career Connection internship experience.